If you walked into a clinic in the United States today to fix a torn knee, you would likely pay upwards of $20,000.
Oh, easily. Sometimes even more.
Right. And that is for a treatment that uses your own aging cells. But, what if you could get cells at day zero of their biological life multiplied by the millions for literally a fraction of that cost?
I mean, that changes the entire conversation.
It really does. Welcome to PlacidWay Pulse, where we help you understand medical travel options around the world in a simple, honest, and practical way.
Yeah, if you've ever felt completely overwhelmed by the cost of healthcare at home or, just frustrated by the endless wait times, you are definitely in the right place.
Exactly. Today, we are doing a deep dive into stem cell therapy in Colombia, and we're exploring why so many patients from the U.S. and Canada are, well, packing their bags and considering this option.
It is a massive shift in how we approach healthcare. I mean, the sources we've gathered today, ranging from international medical tourism data to very specific clinical protocols down in Colombia, they all point to a fascinating reality.
Yeah. We are going to explore how Colombia has built this scientifically advanced, highly regulated infrastructure for regenerative medicine. And it's offering solutions a lot of people thought were simply out of reach.
Right. Out of reach financially and honestly medically.
Okay, so let's unpack this. Let's just be real for a second. For a lot of you listening right now who are dealing with chronic joint pain, torn rotators, or, debilitating conditions like Parkinson's or multiple sclerosis, stem cell therapy isn't just some luxury spa treatment.
No, not at all. It's not experimental curiosity anymore. It's about getting your life back, your mobility back.
Exactly. But when you look at the local costs, it feels completely out of reach. So when we talk about this being out of reach, I think we really need to understand the actual math here. If I walk into a clinic back home in North America with severe osteoarthritis, what am I actually getting billed for?
Well, you're mostly getting billed for a process that is heavily constrained by regulatory bottlenecks. So in the U.S., for example, the FDA heavily restricts the culturing of stem cells in a laboratory.
Culturing, that's the process of letting them multiply, right?
Yes, exactly. Taking a small number of cells and letting them multiply in a lab dish. The FDA's stance is that once you extract cells and significantly multiply or, alter them, you are essentially manufacturing a biological drug.
Wait, seriously.
What?
So just by letting the cells multiply naturally in a dish, the regulatory body says, nope, that's now a pharmaceutical drug.
Yeah, that is the regulatory logic. And I mean, drugs require billion-dollar, decade-long clinical trials to get approval. They want absolute safety and standardized efficacy, which, is totally understandable.
Sure, safety first. But that sounds like a massive limitation for the patient.
It's a huge limitation because North American clinics generally cannot legally multiply these cells before re-injecting them. Patients typically receive what we call uncultured autologous cells.
Autologous meaning from your own body, right?
Correct.
Yeah.
Harvested from you, usually pulled from your own bone marrow or abdominal fat tissue.
So because they can't multiply them, I'm getting a relatively low quantity of cells. And I guess those cells are as old as I am. Like if I'm 60 years old, my stem cells are 60 years old.
Exactly.
So I'm basically paying luxury car prices for a smaller, older construction crew to go in and fix my joints.
That is a brilliant way to picture it, honestly. You have this massive tissue repair job, and you're sending in a tired, understaffed crew. And the kicker is that this single joint injection can easily cost $15,000 to $25,000 out of pocket.
Just for one joint. That is insane.
Yeah, largely because the administrative bloat, liability insurance, and just the clinical overhead in North America are incredibly high. And since it's still categorized as elective in many ways, your standard health insurance almost never covers it.
Wow. A smaller, older construction crew for absolute top dollar. I mean, I can see why people are so frustrated.
Yeah.
So what happens when we look south? Let's talk about the destination advantage. Why Colombia specifically?
Well, if we look at Colombia's regulatory body, it's called INVIMA, which basically serves a similar function to the FDA. They have established a very different legal framework. They allow for the ethical expansion or culturing of allogeneic mesenchymal stem cells, or MSCs.
Okay, allogeneic meaning from a donor rather than from the patient's own body.
Right, and specifically, they're usually sourced from Wharton's jelly.
Wharton's jelly, what is that?
It's a gelatinous substance found inside donated umbilical cords from healthy full-term births. And just to be clear, the mothers undergo rigorous infectious disease screening beforehand.
Okay, that makes sense.
Now, this Wharton's jelly is incredibly rich in these mesenchymal stem cells. Because they come from an umbilical cord, these are highly potent day zero
Oh,
cells.
wow. Day zero, so they haven't aged at all.
Exactly. They haven't spent decades accumulating genetic errors or fighting off environmental toxins or, dealing with oxidative stress. They are biologically brand new.
Okay, hold on. I have to ask the elephant in the room here. If these cells are coming from another human being's umbilical cord, why doesn't the patient's body reject them? Like if I get a kidney transplant from a stranger, I have to take immunosuppressants for the rest of my life.
Yeah, that is a critical question, and it's actually a fascinating piece of biology. Mesenchymal stem cells are what we call immune privileged.
Immune privilege.
Right. They do not possess the specific surface markers, they're called HLA markers, that your immune system uses to identify foreign invaders. So they can literally be introduced into your body without triggering a rejection response.
That is wild.
It is. And because Colombian labs are legally permitted to culture these cells, they can multiply them from a very small sample into tens or even hundreds of millions of cells.
Which brings us to the biggest question. I mean, a lot of people start their research with one single thought. How much is this going to cost me?
Of course. It's
Yeah.
totally normal.
And they see numbers for Colombia, generally ranging from $3,000 to about $8,500. I'm going to push back here for a second. How is it mathematically possible to offer advanced cleanroom labs, highly trained doctors, and hundreds of millions of cells for like a fifth of the cost of a lesser treatment in the U.S.? Are they cutting corners on safety?
It's a completely healthy skepticism to have, but the lower cost is not a result of cutting corners at all. It's really just a reflection of macroeconomics.
Meaning the cost of living in real estate?
Exactly. The operational overhead in Colombia is simply vastly lower. But more importantly, many of these top-tier clinics actually manufacture and operate their advanced biotechnology labs domestically.
Oh, so they aren't importing the cells from somewhere else.
Right. They aren't importing incredibly expensive, prepackaged cellular products from third-party global distributors. By cultivating the cells in their own certified national labs, they just cut out the international middleman entirely. You are paying for the medicine and the medical expertise, not the massive administrative markups.
Okay, so the smarter question for a patient isn't just, what does it cost, but what am I actually getting for my money?
Precisely. Because in North America, $20,000 gets you maybe a few million of your own older cells in one joint. But for less than half that in Colombia, you are getting comprehensive packages.
Like full body protocol.
Yeah. You are getting hundreds of millions of youthful cells, laboratory processing, specialist consultations, guided imaging for the injections, and supportive therapies. It's an influx of cells designed to cross the threshold from just minor localized healing to active systemic tissue regeneration.
I love that. Systemic regeneration. I want to pivot a bit, though, because I think we need to address the destination itself. There are a lot of outdated stereotypes out there regarding South American health.
Oh, absolutely.
But here's a fact from our sources that genuinely blew my mind.
Mhm.
The World Health Organization ranks Colombia's healthcare system 22nd globally. That actually outperforms both the United States and Canada in overall efficiency. Why is that?
Yeah, people are always shocked by that statistic. But it really comes down to how their system is integrated. Colombia places a massive emphasis on accessible, preventative, and highly specialized care, rather than just reactive emergency care.
That makes a lot of sense.
It is a powerhouse when it comes to medical infrastructure. I mean, you have major hubs like Bogota and Medellin, but for regenerative medicine specifically, we really need to look at Cali. Cali is known internationally as the sports capital of America.
Yeah, I was reading about this, the cultural connection there to high-performance sports like international cycling, roller speed skating, soccer. It's intense. But how does sports culture translate to an advanced stem cell infrastructure?
Think about the evolutionary pressure it puts on the medical community there. When you have top-tier athletes constantly pushing their bodies to the absolute limit, severe joint and soft tissue injuries are just inevitable.
Right, and an elite athlete simply cannot afford a 6-month surgical downtime, right?
Right.
With zero guarantee of returning to peak performance.
Exactly. A surgically repaired knee is often never the same. This urgent need really drove the medical community in Cali to pioneer non-surgical soft tissue repair. They integrated regenerative medicine into their orthopedic care out of sheer necessity just to get these athletes back in the game faster and stronger.
That is fascinating. The technology scales down from the elite athletes to the everyday person. And what's amazing is that they haven't just built isolated clinics, they've built an entire ecosystem around the medical traveler.
Yeah, it's a highly coordinated experience.
The facilities we are looking at combine luxury hospitality with those stringent in vivo biosafety regulations. They are creating a literal safety bubble for the patient.
Which is so necessary because traveling abroad for a medical procedure is inherently stressful. You really need that supportive environment. But this raises the most important question for anyone listening. How do you navigate this safely? You can't just pick a clinic based on a nice Instagram page.
Oh, definitely not. And here's where it gets really interesting. The journey starts with a simple inquiry, but you have to know what to compare. Like we said, the cheapest option is almost never the best option.
Right. You really need to look past the marketing language. The very first thing you look for is local healthcare licensing.
So I don't need to look for, like, American hospital accreditations.
Not necessarily. You don't need to obsess over U.S. accreditations, but you absolutely must ensure the clinic meets the local government certifications, specifically INVIMA in Colombia.
Got it.
You also need to ask, is their laboratory ISO certified with medical-grade clean rooms? Are they utilizing flow cytometry to guarantee the exact number and viability of the live cells they're injecting?
Right. And what about the doctor?
Super important. Is the specialist actually board certified in regenerative medicine, or are they just a general practitioner who took a weekend course?
That is a crucial distinction. Well, our sources highlight a clinic that really exemplifies this gold standard. Stem Cells Kyron, located right there in Cali.
Yeah, Stem Cells Kyron is a perfect case study. It's led by Dr. Carlos Eduardo Rojas Martinez. We are talking about a physician with over 30 years of deep medical experience.
30 years. Wow.
Yeah, and he is internationally trained, holding certifications, and having studied in Germany, Spain, and Cuba. He isn't just administering injections, he is a recognized pioneer in biological medicine.
What really stands out to me about Dr. Rojas's protocol at Kyron is that you aren't just flying down, getting a quick stem cell shot in your knee, and getting sent back to your hotel. It is a deeply integrated, multimodality approach.
That holistic approach is the secret to their high success rates. Dr. Rojas doesn't just rely on the stem cells alone. He basically combines high-dose mesenchymal stem cells with exosomes and advanced ozone therapy.
Okay, let's break that down because ozone therapy sounds a little bit like science fiction. What exactly is it, and how does it fit into rebuilding a joint?
I know, it sounds intense. But ozone therapy is essentially intravenous blood oxygenation. Medical ozone is just a highly reactive form of oxygen. Before Dr. Rojas even introduces the stem cells, he uses ozone to prime the patient's body. When it's introduced into the bloodstream, it significantly reduces systemic inflammation, increases blood flow, and modulates the immune system.
So if we go back to our construction crew analogy earlier, if the stem cells are the fresh new workers, the ozone therapy is basically clearing the debris off the construction site so the workers can actually get to the foundation.
Exactly. Or think of it like preparing the soil before you plant a seed. If you inject expensive, pristine, day zero stem cells into a highly inflamed, toxic joint, a huge percentage of those cells will simply die off from the hostile environment.
Oh, that makes total sense.
Right. By using ozone to calm the inflammation and highly oxygenate the tissue first, they maximize the survival and the efficacy of those stem cells once they are finally introduced.
That is incredible. And then we have the exosomes. We hear this buzzword a lot online. What do they actually do?
Well, if the stem cells are the bricks used to rebuild the tissue, exosomes are the site foreman and the blueprint.
Does it like that?
Exosomes are tiny extracellular vesicles. Think of them as microscopic communication bubbles that stem cells secrete. They contain growth factors and RNA.
So they don't build the tissue themselves?
No, they don't. But they are the chemical messengers that tell the stem cells exactly where the damage is and instruct them on what kind of tissue they need to become in order to repair it.
Wow.
Yeah, by adding an extra concentrated dose of exosomes, Dr. Rojas is essentially giving the stem cells a megaphone, amplifying their regenerative instructions.
Okay, to make all this complex biology real, let's imagine a patient from our case files. Let's call him Hugh. Hugh is a historically active guy, but he was dealing with severe, debilitating joint degradation that was just robbing him of his life.
Hugh's situation is incredibly common, unfortunately. He was looking into stem cell therapy because he had torn rotators and detached labrums in both of his shoulders.
Ouch.
And on top of that, he had torn meniscus in both of his knees. He was dealing with a massive amount of structural damage.
Yeah, the guy couldn't even raise a coffee cup off a kitchen counter. He couldn't squat down to sit in a chair without heavily holding onto something for support. I mean, his quality of life had plummeted.
Right.
And when he looked into his options in the U.S., he faced massive sticker shock. To surgically repair both shoulders and both knees, he was looking at tens of thousands of dollars in deductibles and copays, plus months of painful physical rehab where he wouldn't be able to work, and the very real possibility of lost wages. So he starts searching online for alternatives.
And if you've ever typed stem cells abroad into a search engine, you know exactly what Hugh felt: complete overwhelm.
Oh, I bet.
There are thousands of clinics. Some look like luxury spas. Some look really questionable. How do you choose? That overwhelm is exactly what led Hugh to reach out to PlacidWay.
And that was the turning point. Instead of just clicking on the ad with the lowest price, he used PlacidWay to learn how to compare doctor credentials, verify lab standards, and ask about biosafety.
Exactly.
That informed guided research led him directly to Stem Cells Kyron in Cali.
And when Hugh actually made the trip, it wasn't some stressful medical scramble. It was highly orchestrated. Daniel, the patient coordinator at Kyron, picked Hugh up right from the airport.
Nice.
He arranged a secure, comfortable hotel in a great area of the city, and over the course of 3 days, Hugh received a massive customized protocol.
The numbers on his treatment are honestly staggering compared to what he would get at home. Listen to this. He got 50 million stem cells injected directly into his damaged knee. He received another 50 million for facial rejuvenation, which, by the way, is an incredible anti-aging protocol in itself.
Oh, absolutely.
And then he received a systemic intravenous infusion of 100 million stem cells to address the overall systemic inflammation and the shoulder damage, all supported by the ozone and exosome therapies we talked about.
What really stands out about Hugh's journey is his proactive mindset. He took control of his health trajectory. He didn't just accept that his active life was over and he wasn't a passive patient.
Right, he asked the hard questions.
He really did. He asked about lab sterility, he inquired about how the cells were counted, and he demanded clarity on the recovery protocols.
And the results speak for themselves. After returning home and allowing the biology to do its work over the following months, Hugh is back to training with weights, just like he did in his 20s.
That is just amazing.
He even said his local orthopedic doctor back in the States, who was initially highly skeptical of him going to Colombia, was absolutely thrilled with the structural results shown on his follow-up scans. He literally got his life back.
It is a powerful testament to what happens when advanced biological science meets meticulous, patient-centered care. However, we do have a responsibility to be objective here.
I'm glad you brought that up. Let's balance this out because medical travel isn't a magic wand, and it's definitely not for everyone. Let's look at the pros and cons so a listener can actually weigh their options.
Yeah, on the pro side, the benefits are clear and compelling. You're looking at massive cost savings, typically 50 to 70% less than North American prices. You gain access to highly expanded, incredibly potent umbilical stem cells that are simply restricted back home. And you get these comprehensive, holistic care packages that treat your entire body's inflammatory response, rather than just putting a Band-Aid on a single joint.
But on the con side, the reality of the logistics is a major factor. Getting to Cali requires international flights. I mean, navigating an airport when you have 2 torn meniscus in your knees is physically painful.
It's exhausting.
You are spending time away from the comfort of your own home, your own bed, and your own support system while you undergo treatment.
Right, and plus, once the initial therapy is done and you fly back, you still need to coordinate your long-term follow-up care. You might face pushback from a local doctor in your home country who isn't familiar with international stem cell protocol.
Yeah, that happens a lot. It requires a significant level of personal responsibility.
Yeah.
Medical travel basically demands that you act as the CEO of your own healthcare. So what does this all mean for you listening right now? It all comes down to planning and knowing exactly what to ask. Based on everything we've uncovered in our deep dive today, here's a quick 5-point checklist of questions you absolutely must ask any international clinic before you send them a dime.
This is crucial.
Number 1, am I actually a good candidate for this specific treatment? A reputable clinic should always ask to review your recent MRI or medical records before taking your money or promising any results.
Absolutely. Number 2, what local licenses like INVIMA in Colombia and board certifications do the doctor and the clinic hold? Do not just assume. Ask for proof of their expertise and their laboratory's ISO sterility certifications.
Great point. Number 3, what exactly is included in this quote and what will cost extra? Are the supportive therapies like the ozone and exosomes we discussed included in the package price, or are they surprise add-ons once you arrive?
Yeah, you don't want surprises. Number 4, what is the realistic recovery time before I am physically cleared to fly home? You need to know how many days you will actually be required to stay in the destination country.
Right. And number 5, who is my direct point of contact for follow-up care once I am back in my home country? If I have a question 3 weeks later, who am I actually talking to?
Navigating all those questions, cross-referencing the logistics, checking the credentials, that is exactly the void that PlacidWay fills.
Exactly.
PlacidWay doesn't make the medical decisions for you. They act as your guide. They connect you with verified elite international providers like Dr. Rojas at Stem Cells Kyron. They help you compare different destinations side by side, and they organize the overwhelming flood of information so you can make a truly empowered, confident choice.
It takes the chaos out of the process, leaving you with just the facts.
It really does. You know, if we connect all of this to the bigger picture, think about how society traditionally views aging and chronic joint degradation.
We just accept it, right?
Yeah, we have been conditioned to view it as an inevitable one-way street where the best we can possibly hope for is managing our decline with lifelong pain medication or highly invasive bone-sawing joint replacements. But
Right.
what if the future of chronic pain isn't about managing decline at all? What if it's about tapping into our own biological day zero blueprints to actually rebuild, regenerate, and turn back the clock on our bodies from the inside out?
That is a wild, incredibly hopeful thought to leave on. Thanks for listening to PlacidWay Pulse. If you're exploring stem cell therapy abroad or any other medical travel options, take your time, ask the hard questions, and use PlacidWay Medical Tourism to help you compare your options with more confidence. Visit placidway.com to start exploring today.